If you have varicose veins, you know that they cause leg aching, heaviness, and a lot of pain. But what if he told you that you didn't have to live with this discomfort any longer? Dr. Gamal Wazni is board certified in the treatment of vein disease, and he's back today to tell us how to get rid of those varicose veins. And the best part, it's without any pain or downtime. How you doing, Dr. Wazni?
Good, good, thank you.
Let's talk about, first of all, a lot of people are confused, I think, about whether this issue can be treated as a cosmetic issue, which means you can't have it paid for, or a medical issue. It is a medical issue.
Good question. It is a medical issue. If your varicose veins or your vein disease is causing you discomfort, such as pain, aching, swelling, cramping at night, or restless leg, then it is covered by your health insurance.
And a lot of people, I would imagine, would be watching this and saying, oh, come on, this has to be painful. This treatment can't be pain-free, but it is.
It is. The old way of doing things, vein stripping, was painful. Now that we have sophisticated medical lasers, we're able to do this with no downtime. It's not invasive, and therefore it's not painful.
So much easier than before. And because you're saying it's a medical issue and not a cosmetic issue, this is paid for by insurance?
It's paid for by Medicare.
100%?
100%. Blue Cross Blue Shield and all carriers. It is a medical problem.
All right, so what should someone who may be looking down at their legs right now and saying, oh boy, I've got a problem here, or they're in pain and they, have restless legs at night or what have you, what should they be looking for in a doctor to treat this problem?
Look for a doctor with experience. Find a vein doctor who has the experience. Not only should they have the experience in treating vein disease, but they should be certified in the treatment of vein disease.
All right, so someone's walking into your office. What do you look for in terms of treating them? And you don't treat necessarily everyone that comes in, do you?
We do not. We have primary care physicians who send us patients to get evaluated. And not all times these patients will be patients that actually have vein disease. And when they do, we help them and we treat them. We look for the vein disease using ultrasounds. Okay. Ultrasounds are like x-rays. They show us what's below the skin and they show us where the vein disease is.
So it's not just a willy-nilly, somebody comes in, they have maybe a spider vein or whatever, and you say, okay, you need this procedure.
No, we will perform an ultrasound.
Okay. What kind of symptoms might people be suffering from who need to come and see you or a good vein doctor like yourself?
Common symptoms are pain or aching after you've been sitting or standing for a long time. Heaviness associated with that pain. Cramping at night that wakes you up where you'd have to get up and walk around for it to go away. Restless legs at night and swelling in your legs.
Okay. And if these symptoms are not taken care of, what can happen?
The vein disease usually gets worse. So you may notice that these symptoms get worse every 5 or 10 years. That's one thing. The other thing is that the skin can start to become unhealthy, darken, become leathery, and then the unhealthy skin breaks down and you get leg ulcers. You're also at risk for blood clots because the blood is just sitting in these bad veins in your legs.
Is there such a patient that can't be necessarily treated?
Yes, there is. Patients who are not mobile. Okay. The patient needs to be able to walk around.
Okay. All right, Dr. Wazni, great information.